our takeaway message is that our international analysis suggests that adherence to multi-component healthy lifestyles could help individuals with diabetes to prevent cardiovascular disease and premature death. And this finding exists among people with different demographic characteristics, health status, or phases of diabetes. I'm Dr. Yan Guozhang, and I just got my PhD degree at Tongji Medical College, Huazhong University of Science and Technology from China. Now I'm a research fellow at Albert Einstein College of Medicine. I'm very delighted to be there today to talk about our article will be published in Mayo Clinic Proceedings, entitled Association of Combined Healthy Lifestyles with Cardiovascular Disease and Mortality of Patients with Diabetes, an international multi-cohort study. And there are another 4 co-first authors that is Drs. Zhongwei Pan, Qi Lu, Ye Zhou Wang, and Ting Ge. The corresponding authors are Professors An Pan and Gang Liu, also from Huazhong University of Science and Technology, and Professor Shouling Wu from Kalwan Hospital. I'm very delighted to share our paper's findings here. We intended to investigate the associations of combined healthy lifestyles with cardiovascular disease and mortality among individuals with diabetes. This study included more than 100,000 participants with diabetes from China, the UK, and the US. I'd like to introduce the 5 prospective cohorts that included in our study. That is Dongfeng-Tongji cohort and Kalwan study from China, UK Biobank from the UK, and National Health and Nutrition Examination Survey, and NIH AARP Diet and Health Study from the US. So how did we evaluate participants' overall healthy lifestyles? We considered 5 major lifestyle factors, that is no smoking, no heavy drinking, regular physical activity, healthy diet, and optimal body weight. And according to the current guidelines and recommendations, we defined a healthy level of each lifestyle factor. So we compare participants with 4 or 5 healthy lifestyle factors versus those with none or 1 healthy lifestyle factor. So this will help us to indicate the difference between individuals with the healthiest versus the least healthy lifestyles. And we documented around 7,000 new cardiovascular disease cases in cohorts from China and the UK, and over 40,000 deaths in all 5 cohorts. And compared with participants with the least healthy lifestyles, people with the healthiest lifestyles had a 33% lower risk of cardiovascular disease, a 42% lower risk of cardiovascular death, and a 40% lower risk of all-cause death. And these associations are consistent among people from different countries or with different age, sex, education levels, and regardless of how long the individuals live with diabetes or whether they have a glucose lowering drugs, or no matter if they control their blood glucose levels or not, or whether they have, or no matter their body weight, their blood pressure, or their blood glucose cholesterol levels. And our findings are very important to clinical practice. We emphasize the importance of lifestyle management in diabetes care. In clinical settings, we intended to focus on the uses of medication or laboratory tests. Once the patients just made the glycemic goal, we would just be relieved. But for one thing, we have to pay attention to patients' lifestyles, just like the medication or the laboratory test, no matter their conditions, because lifestyles are independent risk factors for patients, the prognosis of diabetes. And for another, we may try different medications to set an optimal therapy for patients, but when it comes to lifestyles management, we just tend to give some general recommendations. Sometimes we only focus on physical activity, diet, and body weight, and without focusing on other lifestyle factors. And right now, I think it is uncommon for the doctors or nurses to formulate a personalized lifestyle strategy for every patient. Of course, we're making some progresses in lifestyle management for patients with diabetes, but there is still a long way to go. And similar to for the patients, when when the patients find that they had high blood glucose levels, they just intend to find a cure from medication, neglecting the importance of daily adopting and maintaining a comprehensive healthy lifestyle. Also, maintaining a healthy lifestyle is necessary all the time, no matter whether the patients are using glucose-lowering medication or having an ideal status of blood glucose, blood pressure, and blood lipid levels, or the body weight. A comprehensive healthy lifestyle will help the patients prevent future adverse outcomes all the time. So I think the most important message from our study is not only tell the public the benefits of healthy lifestyles among patients with diabetes, but also the patients with different characteristics will benefit from just adopting and maintaining a combined healthy lifestyles. And I think in the future, future studies should investigate the effects of healthy lifestyles on microvascular complications and other non-vascular comorbidities among people with diabetes, such as cancer, especially cancer at different sites. As you may know, there is a trend that the major causes of deaths related to diabetes is transitioning from vascular complications to cancer. So it is necessary to formulate some strategies regarding cancer prevention among patients with diabetes. Also, I think we need to use repeated measurements to investigate the changes of lifestyles. This will help us to figure out what is the best period or age to make a change to improve our lifestyle. For example, for patients living with diabetes for a long time, maybe also having some vascular complications. If the patients always follow unhealthy lifestyles, is it useful for him or her to adopt healthy lifestyle? Or the effect of healthy lifestyle is similar for him or her and a newly diagnosed patient. So only by using these repeated measurements, we could just figure out these problems.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.